All right, time being 6 o'clock, I would like to call our Board of Health meeting to order. All members present. We also have with us our Health Director, Marty Golightly, our Public Health Nurse, Lindsay Wright, and Angela, I don't want to call you the trash lady. What's your proper title?
The RICO,
The
Recycling
RICO.
Education and Compliance Officer,
She's also the assistant health coordinator too.
and that. The mouthful.
And we have also with us Chris Macera from Republic Services. So thank you everyone for joining us. First item on our agenda is Republic Services presentation. So Chris, I'll hand it over to you.
Great. Thank you, members of the board. What I'd like to do is share my screen with the presentation, if that's okay with you guys.
Yep. Hopefully you got the ability to do that. Oh, there we go.
Do we have full screen? Everybody see that?
Gotcha.
Perfect. So thanks everybody. Thanks. Actually, thanks for allowing me to go first. So what I'm going to do is this is probably about the second or third presentation I've done such as this. This is the first time I've done it to the board, which I appreciate. And what my presentation is going to show is we're going to kind of talk a little bit about the impacts over the last couple of years in the solid waste and recycling industry, really around two main events. First, China soared, and for the folks that don't know what that is when China a couple of years ago closed their doors to all inbound recycling volume. About 40% of U.S. Curbside volume was going into China, and literally overnight, that closed and disrupted our industry and really put an impact on the municipalities we service, and frankly every municipality that has some sort of curbside program in the country. And then followed up with the pandemic and what that really did to our industry, how we had to pivot in the face of adversity with that. And then I'm gonna kind of peel back the curtain a little bit and show you what we've been doing behind the scenes in terms of the pandemic, and then a little bit of a future look, what we think 2021 will look like relative to both these events, and then really a little bit beyond that as well. I will have some time at the end for Q&A if you guys would like as well. So, a real quick overview of, say, the last 2 decades. When you start to go back to the early 2000s, we really started to see a shift in recycling commodities and really how they were produced and how technology affected that. And if you look over to the left, newsprint by and large was replaced when the iPad and the tablet came on scene. There are a lot of news outlets that just really don't exist today because of that. At the time, newsprint was a pretty valuable commodity. We would collect that naturally at the curb in the stream, and it would have a pretty significant value. And then, what we call lightweighting of packaging, we saw quite a bit of that, in the early part of the 2000s through, say, 2010, and then really today is, think about a water bottle, how heavy it used to be, and now they're pretty flimsy and light. We used to collect 48,000 bottles to make 1 ton. Today, it's almost double. We need to collect 92,000 plastic bottles to create a ton. And if you think about that, it's that many more times we have to collect it. It's that many more times that we have to run that product through a recycling system or recycling facility to make a ton. So we saw huge significant changes in that. And then we kind of rolled into 2018, and that's really where we saw what it was called was China soared. And what China really did was they lowered their contamination threshold, and they started it in, say, 2017. And what they basically said is, we don't want any material that has a less than 0.5% contamination in the material. And if you really think about how difficult that is to achieve, what it basically did was it shut off all the inbound volume. And for folks that may know, we saw dramatic cost increases There was a lot of volume that just really had no home. There was just too much supply out there and really no place to bring it. That's since evolved a little bit over time the last couple of years, and I'll talk about that in a little bit. But that drove the values down and really the costs up. If you remember recycling programs, if you go back to the early days, curbside recycling programs, they were predominantly subsidized by the value of the product that we collected. So in other words, they were below cost. The collection costs were less than really what it cost to do. But on the other hand, the value of the product used to help kind of shore up those programs and cover the expense. That model today doesn't work because there's a pretty heavy cost on commodities. And years ago, we used to get paid for them. So, we kind of saw that, and we saw the price and change, and then here we go into 2020, and it's a world pandemic, and I think everybody certainly in this presentation on this call has been affected by that in some form or fashion. It's affected everybody. It's affected the whole world, and it certainly affected our waste industry dramatically. But the interesting thing, and a lot of times when I look at this slide, big takeaway is, I've been in the industry many years, and we've had two major global events in the last, say, 2 or 3 years, China sword and the pandemic, that have literally pivoted this industry. We've had to shift on how we do things and how the cost structure is in them. I've never seen two events of such magnitude affect the industry so much, and lo and behold, they were within only 3 years. I haven't seen that happen in 25 years in the industry. So when we look at 2020 a little bit more in review, in terms of the pandemic, what did that mean for us? And the national lockdown and having people work from home. We saw businesses and schools. We saw it in our own company in Republic Services. Within a couple 3 days, we had all our non-essential employees, some folks like myself, about 6,000 people, literally shift in about 3 days to work from home status. So actually something I'm pretty proud of in the company, because we did it very effectively. And then we kind of got into Q2. We had to implement a lot of different safety protocols and procedures in place with our staff. But the big thing is we saw a dramatic shift in the volume, and a lot of that is just simply from the fact that people were once working and attending schools to now being home. We saw our commercial volume. That's stuff like containers at restaurants and schools and markets and such. We saw that volume dramatically shrink, as much as 20%, in some cases more. But in the reverse, we saw the residential volume, the volume at the curb, dramatically increase. We have some collection contracts. We have some markets. We saw that volume go up 30%, literally within a couple of weeks up. Now, we've that volume, that 30% since is kind of leveled off a little bit as we kind of jump, through Q3 and really Q4 of the year. We saw that come down, but we're still seeing, from a really a national look, roughly about an 8-10% volume change, both in trash and recycling at the curb, greater than pre-pandemic levels. And we really kind of anticipate that to stay through 2021, and I'll talk about that in a minute. As we go. And then, recycling through the years, early on the year, kind of was early pandemic, we were just really kind of monitoring the investments in a lot of the domestic mills. The pandemic really didn't take hold then. Obviously, the commodity market wasn't great. So the value of commodities relatively flat in the first part of the year. But then as we got into the second quarter of the year, obviously, we've kind of got the pandemic impact of it. And we just saw a shift in the consumptive behavior out there. So we saw a shift in materials at the curb on recycling. We did have some concerns about contamination. With a lot of people being at home, we were worried about that. But we did see a shift in the volume, and we saw it dramatically more in, probably I'd say, in the third quarter. are the demand for, say, fiber and aluminum, fiber being cardboard, paper products, aluminum, certain plastics, those were going up, and that's a function of people being at home. And then we did see a lot of small and mid-sized processors that process recycling. We saw a lot close their doors and go out of business. They just weren't able to kind of weather the storm for that. So that certainly didn't help on the supply side. And then, in Q4, we were just, obviously we had the continued headwinds of the COVID. So, the interesting thing is, is China sword and the pandemic have really made some what we call like structural changes to the industry. They're not business changes, because a business change is generally a cycle, but these things are major structural changes within our industry. So, what did we do? We put a big emphasis on our safety and our business continuity plans as we kind of rolled through 2020. We made sure our frontline workers had the proper PPE. We certainly needed them in greater supplies than we ever had. But, the interesting thing is we've always had those. We were probably a little bit better equipped than most industries, and we already had the supply chains in place in terms of PPE, because it's just, we're inherently a risk industry. So we probably had a little bit leg up on that. Plexiglass, I think I wish I owned a company that made plexiglass during this, because I don't think I've seen so much plexiglass in the last 12 months. But that affected us. We had to equip our facilities and our dispatch areas and the recycling facilities we own. We've had to even install those in between workers. We've even kind of leveraged outdoor locations in our facilities. So, the way it kind of works with us is every morning our drivers start with a huddle. We used to do it indoors. We now, we took it outdoors, and we've kind of built makeshift break rooms to kind of accommodate that. And then we had to, obviously, cleaning our facilities. We had to really redo how we sanitize and clean our facilities and our trucks, inside our trucks. We do it on a pretty routine basis now. It's much different than we did before from sanitizing practices we used to have. Fortunately, I'm proud to say, throughout the country, we operate in 41 states. We have not had to close down a facility because of COVID. We've been very fortunate, and I think a lot of it is off the backs of a lot of efforts we've made. We've certainly had cases, but I'll tell you, if we ever get a case of an employee, our facility looks like a crime scene cleanup. We go through them tremendously just to make sure we don't have any other issues. And we really believe that that's helped. And then lastly, our frontline employees, what we did in a good part of last year is we started what we call our Committed to Serve program. And we gave all of our frontline employees for 8 weeks an additional $400 gift card every Friday we gave them. And what we wanted them to do, one is it was thanking them, throughout this pandemic, but we also encouraged them, our employees work and live in the communities we service, and we wanted them to go back into the community with that 400 and spend it on businesses, spend it on local businesses, spend it on even customers of Republic Services in those communities. It was a great way to kind of really give them money and then really get it back in the community and help out local businesses. It's huge success for us as well, something we're really proud of. So, I mentioned earlier about, when China closed its doors, we obviously saw the supply chain shrink dramatically. So, most of a lot of the single stream volume, it did create new markets. A lot of it still in Southeast Asia, albeit not China, whether it was India or Malaysia, Vietnam. But one of the things we're starting to see, and this map represents, is these are planned dots of plans out there of mainly fiber market planning. So they're plans on the board where here domestically, the U.S. we're working to, and these aren't our facilities, so to speak. Some could be, but they're not certainly all ours. To create a market for keeping our paper product, recycled paper products domestically. So what it's going to ultimately do, kind of a long view. And again, these are plans, so they do take, capital investment, typically a 3-5 year cycle. It's going to create at least some end sites domestically. So as companies don't have to ship material all over the world, we can keep it locally within our shores. When China was open, we were shifting, roughly 10, 15, 20 million tons to China. This represents only about 6 million. So it's only, say, maybe a third of that volume. But, it's at least a step in the right direction to help. And we're starting to see some better pricing on the paper markets as we've kind of gotten into 2021 as well. And I mentioned earlier, the shift in the volume from the pandemic. And, as we look on the left side, I did mention earlier, our commercial line of business, we call small container, large container, containers at businesses, restaurants, schools, and so forth. That volume went down dramatically. It's still down. It's certainly making a comeback as things begin to open up, but it's not where it was pre-pandemic. But that volume, where did it go? It went to the residential side of the business. It went to the curb. In a lot of cases, what we had to do, even certainly in Abington, our drivers were working more hours, and they continue to work more hours, picking up extra volume. We may have had to go and dump more than once because there was more volume than we were used to. It's really changed the structure of the program on the way things used to be in a lot of our municipalities because of that volume shift. And I also mentioned earlier material composition changes because of the pandemic, and we've seen this shift because of consumptive behavior, particularly in the residential line. We've seen a very large increase in what we call small cardboard, and that's the e-commerce. So I've heard the term the Amazon effect. That's a direct result of the pandemic and people being at home. We've also seen a record amount of aluminum, PET, and glass into the recycling stream, more so than we've ever seen. A lot of that is beverage containers. Aluminum is predominantly used in the beer can market. That's why. So we've seen a lot of that spike over the past 6-8 months. But a good thing is overall we've not seen a dramatic increase in contamination. We took a position last year. We were very concerned we'd see higher levels of contamination, on a national look in the recycling stream. And by and large, we've not. That's a good thing. We have seen it. We've seen it in some markets and in some towns, but overall, it hasn't been as a concern as we thought it might be. And then in the commercial side, we saw large drops in material and OCC, which is cardboard, and office paper. Naturally, offices are closed. We saw that demand and go down, but kind of a mixed bag. We saw a lot of material come up, say from retail, grocery, big box as well. So, and then on the industrial side, or what we call sometimes our roll-off line of business, it's kind of a mixed bag. Construction was in some cases deemed an essential service, so that continued. So we probably saw a little bit less impact on that. So, again, the takeaway is the pandemic has caused a shift, not only both in volume, but in the customer segment, as well as that composition of materials that we're seeing go into the recycling stream. And then earlier, I mentioned the commodity value. I know this is a little bit of a busy screen, but if you look on the left-hand side at the graph, probably the best one to key in on is the dark blue one in the middle. We call the basket, and that's the mix of all the recycling material, same as recycling material we collect in Abington at the curb. Now, this is a look from a couple of years back from Q1 of 2017, which was prior to China closing. And you kind of see that black line at 0%. It's up. And then you see the dotted line where China closed, which, again, it literally closed overnight. And you see that line go down. And that's the value of the commodities that have gone down. And then it hits that pandemic line. And we're starting to see this slight increase in value, and that's a lot of it is off the backs of the the paper commodity market, the fiber has gotten a little bit more valuable. So we're starting to see some positive momentum, and that's a good thing for municipalities, because the commodity cost that you've been getting per ton is, used to be last year predominantly was, $100 or higher. It's starting to come down now. I'm starting to see numbers in the 70s now, which is a good thing. So, what do we think it's going to look like? What are our trends and our prediction as an industry in terms of volume? So if we look on the left-hand side, residential, that spike up there, is the COVID effect, where we saw the volume go up. But the thing I probably really want everybody key on is the dotted orange line. That is our trend and our prediction as we come through this year. And as you'll notice, it does not come back down to the pre-pandemic level. We're making a prediction. We're pretty comfortable saying we'll see anywhere between a 7 to 10% additional volume at the curb, and that's both trash and recycling as we kind of roll through 2021. And frankly, I think it's going to go, further, right? I think a lot of the things that we've experienced this year from the pandemic are here to stay. I think companies have realized the great experiment of people working from home, by and large, has worked, and we're going to see that continue. And that office setting, so to speak, is going to probably remain not to the level it once was. That's just going to mean that volume is going to remain at the curb. So we're not sure volume is on a per unit basis is going to ever come back down to pre-pandemic levels. It's here to stay. And on the commercial side, that dotted line, we're convinced over time that should somewhat normalize to pre-pandemic level. But it's going to take some time. I think a lot of it is once hospitality and travel and really starts to get their footing back, and sporting events. I think we'll start to see that. We'll start to see the commercial recover probably a little bit quicker, and probably more towards 2022. So, through all this, through the pandemic and through China closing and the commodity market crashing, we've saw a lot of municipal programs modify themselves in a lot of different ways. We've saw in most cases, we've seen it through rate adjustments at the curb, whether cities or towns were charging their residents. We've seen a good chunk change of service. Maybe they lowered instead of weekly recycling, they went to every other week. Maybe they reduced yard waste collection or bulk or something. So we saw changes of service throughout this to help offset some of this. In some cases, we've seen changing of material lists, maybe in the recycling side of it. Here in Massachusetts, our recycling is really, we're governed by a DP list on what the waste ban items are, so we don't necessarily can shift that change. And then kind of extreme, which I certainly don't recommend, is we've seen some programs just cancel completely. There's been some cases where municipalities have just said, I'm not going to recycle anymore because it costs too much. Again, that's not something that I've seen here in the Commonwealth, nor will really be allowed to be done, but it has happened in certain parts of the country. And then we've seen some just burn recycling. We were involved a little bit in the Philadelphia market when that happened, and they took their recycling material and incinerated it for some period of time as that rate went up. So, again, those really aren't on the table for us, but but I think canceling a program is the last thing I think a municipality would want to do. So we have a fairly aggressive sustainability goal. We have a 2030 sustainability goal, something I'm really proud of. We're really strong on recycling. It is part of our sustainability goals. I think sometimes we talk about, what are the smart things to recycle? For example, aluminum has the best impact on the environment. For every ton of aluminum you collect, you eliminate 9 tons of CO2. So sometimes we certainly try to look at stuff like that, but our sustainability goals are certainly revolved around safety, engaging our workforce. We're big on climate. And then our charitable giving platform, we give away $20 million in our charity platform. We actually boosted that up another 3 million during COVID as well. And lastly, we're very, as a company right now, we're very bullish on EV or electric vehicles. We are currently piloting some electric trash trucks throughout the country. It's more of a long-range look, but it's a space that we're really, really exploring heavily, and from top down, from our executive branch of our company all the way down. We kind of see it as the future as we kind of start to roll through. So something that's really, really exciting in the future, I think, for us and the customers we service as well. So, again, I think in terms of a municipal look, I think we should always be continuing to look and talk about modernizing our programs where we can. We always want to update our contracts to reflect the current events. And in this case, how does the pandemic affect it? How does the commodity market affect it? So it's something we always want to look at. We have talked about that, certainly here in Abington over the last couple of years. And then we want to make sure the collection assumptions reflect the current reality of those changes, as well as evaluating the recycling program. Again, we don't necessarily can't shift the commodities we're collecting because they're governed. But probably the best thing we can do is increase our public education. We've got some great resources and tools that are free to Abington to use. And actually, one thing we've created recently that I can certainly share with the staff later is we've just created a K through 12 curriculum for the schools that we'd love to share with the town. It's a full program. It's already put together. We just need to get it into the superintendent and the teachers' hands, and they can use that program free of charge in the schools to help recycle. There's always a belief too when you think about it. Just like anything else, when you teach children the right way to recycle, it's kind of a lifelong habit. So that's usually the best place to start. So, gladly make that available to you guys as well to share. And then lastly, if you don't know, there's we've been fortunate to get a lot of really great accolades. Forbes 2020, we've been best employee for women, Dow Jones Sustainability, we're a member of that as well. We've been certified a great place to work and a number of other things as well. So there's a lot of good things we're really proud of that we've been able to accomplish over the last couple of years. So with that being said, I'll turn it back to the board. Any Q&A, any questions, I'd be happy to answer.
Thank you, Chris. That was pretty thorough.
Yeah, thank you.
Yeah, this is Christina. I do have a question.
Sure.
How does Republic assess new needs at the municipal level? Like for our community, how are you assessing what our citizens are looking for in the future? Things like, for example, hot topic on my mind is like computer waste, iPad waste, things like that type of electronics waste coming up in 2022, 23.
Yeah, so, those are conversations I think we should have based on, the needs of the residents and what the residents may be looking for. We do service that. So we can collect e-waste. We do have those programs that are available to do. So, we like to try to think we're one-stop shop for all that stuff. But those are things depending on where we think needs are. We can certainly talk about it and do it. We got a pretty good, right now we got, weekly trash, weekly recycling. So we've got a pretty, and we're fully automated. So residents have carts in town. So that's a great step in the right direction in terms of the collection we're providing. So those are, if they're add-ons such as e-waste and stuff, yeah, we can certainly explore that.
But how do you survey? Like, how do you determine a certain area might have future needs in the future? Is there like active surveying going on, or do you have kind of like a sister city that you kind of do comparativeness with? I'm just kind of curious how that works. Planning.
I think we can look at, we service 2,500 municipalities across the country. So we probably have every sort of, I'd say coverage of service out there. A lot of it sometimes comes down to some demographics of some communities are different. So we would certainly look at that. We don't necessarily send out a survey, so to speak. Like we don't just send out a survey to Abington residents to say what you're looking for. I guess we could. I mean, we could partner with the town to try to figure that out. So there are mechanisms, I guess, to do that, but we don't kind of have a survey we just send out to residents to figure that out. We could, I think the best way is we could just kind of show you and say, hey, look, here are all the possible services we could do.
Mhm.
And then maybe from there, we can say, okay, what may make sense for the town?
Okay. Yeah, no, that's kind of what I'm curious about. Like, how do you get the demographics and figure out like those ongoing future needs?
Yeah.
That makes sense. And then you, because of course I've been Googling while you've been talking. You guys have like an organics recycling program, and I didn't see that on your slides. Can you just real quick, what is
Yeah.
for the uneducated person that's
No, that's right. So when you hear organics, you're usually thinking about, food waste. Sometimes people even say, some sort of yard waste collection. So we do have organics collection, albeit there are certain markets in the country that it's more robust. We see a lot of it on the West Coast.
right?
We've got a really huge operation, I believe, in Boise, Idaho, where we even operate a compost site. So we do it. The balance with organics is the economics, and that's really where it has to come down to. So we don't do a lot here in the Commonwealth. We don't do much at all. But the question, and if you really think about organics and how you have to collect it, it's a separate cart, it's a separate truck, it's a separate disposal number or where it's going to go. And do those costs offset the diversion out of the waste stream?
That's kind of, yep, and that kind of leads back to the other question, like how do you figure out that perfect cost-effective balance between what's nice to have and what do you need? Okay,
Yeah, just like that. And usually those programs tend to work when the economics work.
gotcha. Okay.
That's where they work. But there's been a lot more conversation, not only around here but throughout the country about organic waste as capacity begins to shrink on the disposal side, which Massachusetts is, the hot zone for that. We have dramatically decreased in trash disposal capacity to the point where we're exporting a lot of volume out of state at this point on rail even. As things start to evolve, organics may gain a lot more traction in that conversation though.
Interesting. Well, thank you so much. I appreciate it.
Anytime. Any other questions?
I think we're good. Chris, thank you for joining us.
No, thank you for having me. Appreciate it. Thank you.
Thanks.
Yeah, thank you so much.
Thank you.
Okay, so the next item on our agenda is a COVID-19 update. So Marty, I'll just throw that over to you real quick. Oh, you're muted.
Muted.
Oh, rookie move. Sorry, everybody. The COVID update, we have 37 currently active cases with, it brings us to a grand total of 1,615. And I believe that means 1,587 are discontinued from tracking. 1,578, excuse me, my math was wrong. That's very good news. 37 with only, Lindsay will correct me if I'm wrong, 52 residents currently in quarantine. These are our best, our lowest numbers in quite some time, since at least before Thanksgiving. So I sincerely hope we are trending in the right direction. The vaccine, the continued use of masks, and good practices and no gatherings. I'm expecting a small Super Bowl bump, but we should see that this week, if at all. So as of right now, that's our COVID.
With school vacation, just be mindful of activities and hanging out and social gatherings.
Yes, please. Like to keep our kids in school as much as possible.
Much as possible. And Yeah, that's really, Lindsay, I don't have anything else as far as specific COVID update unless you do.
No, the numbers are the best we've seen, like Marty said, since I think before Thanksgiving.
Yeah.
So keep up the good work. I know it's stressful and hard, but we appreciate it that people are adhering the guidelines. It shows.
Good, we're making progress. All right, so the next item on our agenda, which I think anybody listening is probably here for, vaccine clinic update. So we aren't really anywhere currently with that. That hasn't changed much.
It hasn't changed much. Well, it has and it has not. In that I am hopeful, and we have received some assurances that we will be able to vaccinate everybody who received their first shot in Abington should be able to receive their second shot. I don't want to put the cart before the horse on that. I don't have the vaccine right now that would guarantee that. So I still encourage everyone to reach out to Gillette or to Marshfield or to wherever else is convenient for them at a pharmacy to make an appointment for their second dose. And in the case that we don't receive it, we are continuing to advocate with our counterparts in the state that Abington's EDS, which has been approved for many years to function as an emergency dispensing site, both drive-through and walk-through, be given the doses and be allowed to vaccinate not only Abington's residents, but residents of other towns as long as they are pre-registered and do so. The current climate is that is not something the administration wants to pursue, but we are still advocating highly for it. We're advocating highly for it because we live right next to Brockton and Randolph, two very hard-hit communities, and if we can help by vaccinating all of those people, including Abington residents, we will do so, because all of those people live and or work in town. And we don't want our seniors driving in bad weather and waiting outside in bad weather. We want them to go to places that they know and trust, like the Abington Council on Aging and Senior Center. So we will continue to aggressively advocate on behalf of the citizens of Abington that we should be allowed to vaccinate our residents. And if other residents from other towns want to make arrangements, then we should be able to vaccinate them. This should be a complete team effort from the top down, the state, to the federal, to the state, to the local level. That being said, we do have a first responder clinic tomorrow for their second doses. We're very excited. We've invited leadership from the state, leadership from anywhere that else would listen to come and take a look to see how effective and how good we are at this. And we are very good at this. So we will continue to do our best to advocate strongly that Abington receive as many doses as the state can send us, because there will be no lag time. If we get doses on a Monday, we will put a clinic on Wednesday and we will give them all out. There's a laundry list at the senior center of about, I think it's almost 700 names now. And that doesn't include the one that Angela has had to create, and Mary has had to help at our office. So we are ready. We continue to be ready, and we will continue to keep our foot on the gas.
So just to clarify, because there's been some misinformation floating about, we're not sitting on any vaccines. Currently, we do not have any, but we are hopeful that we will have second doses, but those are not in hand yet.
Those are not in hand yet. Except what we do have for tomorrow's clinic, but not for the clinics a week to 2 weeks out.
Understood.
We were specifically told not to sit on any doses. So if we were given them, we were told to put them into arms, which we did. So now we are in wait and see mode. And we are, I said it 1,000 times and I'll say it again. We will continue to aggressively advocate that Abington receive, not just Abington either. I don't want to make this seem like we're part of a working group of about 12 to 13 communities that have partnered together. We will continue to work aggressively to make sure that all of those communities at the local level who've prepared for this through the FEP coalitions for years now, and then to be told that we are not going to be part of any of the public health emergency plans, it's incredibly frustrating. So we will continue to do our best to make sure that we can vaccinate our vulnerable populations in town where they are, because they deserve it and it's the right thing to do. Lindsay, you want to add something to that?
No, you summed it up great. We communicated to this morning about the situation just in an effort so that everyone knew the situation we were in and for planning purposes. We have not canceled any clinics. We have made everyone aware that we don't have the doses, but nothing has been canceled. Chris, you mentioned the misinformation. We don't have the doses in hand, but we are, like Marty said, aggressively advocating to get these doses. And as soon as we get notification or they show up, I will communicate immediately that we have them. And our hope is that we get to move forward with our clinics. If nothing else, finishing the vaccine series of the residents and the eligible populations that we've already vaccinated.
Thank you. And people who, from what I've been hearing today, people, they can supposedly make appointments elsewhere for a second shot if need be. I'm hearing from people that they're being turned away by the mass vaccination sites for second doses.
I certainly hope that's not the case.
Unfortunately, I've been getting messages like that as well.
But that's nothing to do with us.
Yeah,
So
nothing to do with us.
The big part is if someone is going to seek an appointment elsewhere, they were given the Moderna shot. And so they have to go to a clinic location that has Moderna because you have to follow the same manufacturer of your vaccine. And so all Abington first doses were Moderna. And so if they are seeking appointments elsewhere, they do need to find a clinic that has a Moderna vaccine available.
That probably has a lot to do with it.
I know Fenway is one of the mass vaccination sites and they are using Pfizer. So Fenway is not an option. As one of the sites that I know what they're using.
And hopefully we will get second doses, and we will be able to provide for our seniors and for our vulnerable populations in town. That's the dream. All we want is to do the thing that we're good at, the thing that we have prepared for forever.
And as soon as we have a solid lead on that, information will get out to people. So don't worry, you will definitely be hearing from us.
Yep. And Suzanne, Amanda, and Amy at the Council on Aging are fully prepared to help make all of the necessary phone calls to our seniors as well. So you will know as soon as we know. But the hope is we will be able to give them in town.
Excellent. Anybody have any further questions or discussion on vaccine clinics? All right. Next item on our agenda is an open letter to Governor Baker regarding the vaccine distribution. So I asked, and Christina was nice enough to draft up a letter from the board to the governor's office addressing our concerns and frustration over the current plan. Has everybody received a copy of that and read it?
Yes.
So because it's a draft, it's signed, but we still need to discuss and vote on it before that goes out. I guess I should probably read that out loud just for the record, because we don't have a copy of that to post. So if you will bear with me. So the letter reads, to the Honorable Charlie Baker, Massachusetts State House. Dear Governor Baker, we apply for your immediate intercession. It is pertinent you are made aware the Department of Public Health has created an unsubstantiated administrative barrier which is actively denying Abington citizens timely and safe access to the COVID vaccination. On February 8th, Ms. Jana Ferguson directed that authorized emergency dispensing sites will not be provided vaccines for community distribution. There was no proactive communication, no cause, and this was in response to repeated emails petitioning for explanation of unfulfilled vaccination orders. The Abington EDS has been an approved EDS for many years in accordance and compliance with DPH policies and procedures for the explicit purpose of vaccination distribution. Since implementation, the Abington EDS has held its first distribution event for Phase 1 first responders and has flawlessly passed all annual review requirements, which include walkthroughs with state officials who have been nothing but complimentary. Former FEMA Director Richard Serino specifically praised Abington's EDS on January 29th. I think what you have done in Abington can and should be a template, not just here on the South Shore, but for Commonwealth and also for the country. You should be a model for how it should be done at the state and federal level. However, without grounds, Ms. Ferguson denied the Abington EDS vaccinations. She has cited that to receive phase 2 vaccinations, we must adhere to new proposals that need to be submitted, proposals that were not proactively communicated nor have been provided. We highly doubt it is the intention that unpublished administrative requirements should incapacitate a compliant EDS site in the midst of a pandemic, literally shutting down a medical resource between a phase 1 and a phase 2 disbursement. Denying our town vaccinations will unexaggeratedly force our highest risk citizens to jump through administrative hurdles to get approved for vaccines elsewhere, travel to alternative towns, and stand outside in long lines at overburdened dispensing sites. Those without ready transportation or unable to withstand the cold will simply not get their second vaccination dosage. Governor Baker, we need you to intercede immediately at the Abington, as the Abington EDS is currently between phase 1 and 2 distribution when this denial occurred. There are approximately 17,000 citizens relying on you to return their health care to the capable hands of the vetted and experienced Abington EDS, which stands ready and able. In 2017, you built a platform on your success in reducing red tape to allow cities and towns to do their job. We ask that Governor Baker be our advocate today. Our job is to prevent illness and assure access to high-quality public health care services, remove the red tape, and allow us to do it. In solidarity, members of the board. So that's the letter that we're proposing on an open letter sending to the governor's office. Would anybody like to discuss that?
I just want to say thank you to Christina and Chris for, drafting up this letter. I think it's important that we send this to the governor's office. As we all know, that we've hit a pandemic, the whole world and our community. And what we've learned, especially throughout this pandemic, is small government and really the state government giving us the ability to keep Abington safe and take precautions. Abington is extraordinary, and I know with the leadership of Marty and Lindsay, we've been able to do many things that other towns and cities, wish they could do. And I think it's absolutely perfect in this letter that, we are a template for the rest of the state and even the country as well. We took early steps in this pandemic before the Commonwealth did about mask wearing. We took precautions, in traffic in large stores. Abington leads on this, and seeing the clinics firsthand and the communication that we've been able to bring to the residents so they can get vaccinated has been absolutely incredible and remarkable. And actually seeing other towns and communities come to our vaccine clinic to learn, how it's done right. And I think it's important that we're able to continue to do that work. And especially, since this pandemic came about, the state government told us, that we were going to be the ones in charge of potentially whenever we had a vaccine rollout. And now to have the rug be ripped from under us and it be poorly executed by the state, I think it's important that we share our views and bring it back to Abington.
Any other discussion on the proposed open letter?
I agree. To just kind of piggyback on what Alex said, it's not just about Abington, it's about the other places that are being impacted by these types of administrative decisions. Policy should not stand, or process should not stand in the way of progress. And it's kind of like, if we don't speak up, and I think we have the greatest foundation for our own EDS program to say something, what chance do the other towns even have? So it's something we do for us, it's something we do for the other citizens, but it also brings a highlight to the towns that might not have the strong footing to kind of speak up for themselves.
Okay. There's no other discussion. I will take a vote to approve this or disapprove.
I'll make a motion to approve.
Okay, we have a motion. Do I have a second?
I'll second the motion.
We have a second. All in favor of approving an open letter to be sent to the governor as read, please say aye. Raise your hand.
Aye.
I,
Right, so that's unanimous. We'll get that sent out. Thank you, Christina, for using much prettier words than I would have.
real quick, I do want to say thank you to some members of our local area leadership for their continued efforts behind the scenes to move everything forward. So those people, you know, it's a tough situation for everybody. So I just wanted to say a thank you to that before we moved on. Sorry.
No problem. Yeah, thank you to especially our fire department guys who we know are equally frustrated over this. Next item on our agenda, compost site fees. Angela, you get a chance to talk.
Yes, hello. All right. So the compost site fees, I really just want to focus on mostly the electronic recycling. So we use RMG Enterprise as a vendor. Their pricing went up a little over a year ago. So I did research other electronic recycling companies, and if they weren't at the same price, they were more money. So we did stick with them. Let me just look this. So their pricing did increase from 19 cents a pound to 22 cents a pound, plus their pickup fees as well. So for the 2020 season at the compost site, the total amount that we received from residents just for the electronic recycling was $4,872, and the total amount paid from us to RMG for pickup was $6,463.90. So obviously we took a little bit of a hit there. So to propose an increase in pricing, I just drafted up some prices that I'll read off. So for computer with monitor and accessories and AC units, they were $10, and they'd be going up to $15. Microwaves will go from $5 to $8. Space heaters and printers will go from $3 to $5. And then for the TVs, for up to 75-inch from $15 to $25. 27-inch to 40-inch would go from $25 to $35, and projection TVs from $30 to $40.
It's not terrible.
No. So with that increase, it should balance out. I did calculate, let me pull it up, I have it on here. So I crunched the numbers on what we would if we had these numbers this past season. The total deposit would be $7,206, which would leave an extra roughly $700, but that would go right back into the compost site for things like having the porta potty for the volunteers, because that for last year alone was right around $700. We do the tick and mosquito spray for them as well, and any other thing that comes up with the volunteers. I know now they're going to need masks and stuff like that, hand sanitizer, all that with them down there. So just go right back into the compost site.
Nice. Excellent. Thank you. Do we have any discussion on the site fees?
No, do we have to make a motion to approve those?
Can I add something real quick? I just want to thank Angela for all her hard work. I know it's not exactly glamorous work. It's a lot of grody, nasty work over at the compost site, counting these things and then going through all the receipts and making sure that we're doing this right, making sure we're using the grant money when we can, and all of that. So thank you, Angela, for all your hard work over there and for doing all of that. And we would only ask for these increases if we absolutely have to. This is something that we didn't want to do, but to keep these programs sustainable is it's just the nature of the beast. It's just something we have to do. And this kind of goes back to what Chris was talking about. I know he said that he could pick those things up with Republic, but we know when we do it here at town, we know it's recycled. We know where it goes afterwards, which is kind of kind of important to us. You know, we want to see the man behind the curtain.
So we haven't raised those fees yet.
No, we wouldn't be able to do that without a motion from and acceptance from the board.
That's what I thought. Okay, so we don't need to do it yet?
We'll have to do it before the compost site opens in Angela, March, second week of March.
March or April. I'm making the schedule now.
Did anybody want to make a motion?
I was gonna say, why don't we just make a motion now? I'll make a motion to raise all the fees to exactly what Angela just said.
Okay.
I don't have to do them individually, I don't think.
I won't make it.
Thank you.
Do I have a second on that?
I'll make a second.
All right. All in favor, say aye.
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 All right. Aaron has left, so we got that's 4-4, 1 absent. So that passes. All right. Last item on the agenda is we have 2 meeting minutes to approve. The first is January 19th. So I think they were all mailed to everybody. If you have a chance to read them, I'll accept a motion to accept the minutes from the 19th, January 19th.
I'll make a motion.
Awesome. Do I have a second?
I'll second.
All in favor?
Aye.
All right. Minutes are accepted. And the second one is from February 1st. I think Christina and Linda were absent for
Yeah.
that. Aaron has left, so Alex, it's you and I. I'll make a motion to accept them.
I'll second the motion.
All in favor? Aye.
Aye.
All right. So those are approved. That is all I have on my agenda.
Motion to adjourn.
Do I have a
I'll
second?
second that motion.
All in favor of adjourning, say aye.
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 Before we adjourn, I just want to say again, thank you, Lindsay, Marty, Angela, for all that you guys are doing. I know it's a lot on your plate right now. Thank you. We appreciate it.
I mean, I appreciate you saying thank you, but it's not necessary. This is what we do. This is what we love to do. We are all in this for public service. What we do.
All right, meeting adjourned.